But first, breaking news. The state of Michigan reporting an alarming spike in new coronavirus cases, about 1,300 more than the previous record set earlier this month. State officials continue to sound the alarm, saying it is more important than ever to take this seriously.
3,338 new cases reported today in Michigan and 35 more deaths. 27 of those are from a review of records. This week also breaking the record for Michigan's 7-day rolling average. Larry Spruill is live with what these numbers mean and what we can expect going forward. Good evening, Larry.
Good evening, Steve. Good evening, Priya. A lot of people are probably wondering with these new numbers, are we facing a second wave or a possible second shutdown? Now, I spoke with Dr. George and state leaders about all of this. Take a listen.
I think that there are circumstances under which the governor could make the case that there is a new emergency because of an increased spike.
That's a possibility, says Attorney General Dana Nessel. When it comes to another state shutdown, Michigan's health department reported Saturday the number of confirmed COVID cases in Michigan is now 158,026, including more than 7,000 deaths. But here's where things are even more alarming. Saturday's update alone, 3,338 new cases and 35 additional deaths. Nessel says Saturday's numbers are alarming and she's afraid things will get worse because this time the governor's powers are somewhat limited.
But what concerns me is what I hear over and over and over from the Republicans is that they don't believe in shutting things down, that they are big proponents of keeping everything open and there's no reason to shut anything down.
I also asked Local 4's Dr. Frank McGeorge if he thinks there would be another shutdown.
I think what we need to do is look at the numbers and figure out where they're occurring in the state, if there's a reason specifically that they could be occurring. In other words, sometimes the numbers are the result of a correctional facility or a significant number of nursing facilities that became infected. We need to figure out what the more likely source of the larger numbers were. If the source of the larger numbers can be nailed down, then action can be taken against those specific sectors.
And Dr. McGeorge and Dana Nessel are saying that the only way we really can get through this is if the government works together. I am working on that part of the story, all new tonight at 11. We're live in downtown Detroit tonight. Larry Spruill, Local 4.
All right. Thank you, Larry.